side, so I'm going to hold doors on one over there.
Good afternoon, everyone. Thank you for being here today. My name is Sally Bradshaw, and I'm the chair of the Tallahassee Memorial HealthCare Board of Directors. And on behalf of our 6,000 healthcare workers, it is my sad responsibility to open this gathering today. TMH wants to extend our prayers and love to the patients and families impacted by this tragedy and to the larger FSU community. Dr. McCullough, who is with us today, administration, faculty, staff, and students. This has been an incredibly difficult time for our community. We're here today to provide an update on the medical response and care following the tragic incident that occurred on the FSU campus yesterday. Our goal is to be transparent, informative, and respectful to those impacted, while also protecting patient privacy. I want to take a moment to thank the first responders, law enforcement, and emergency personnel whose swift actions helped save lives. Our emergency room and trauma team are the very best, and their dedication to this community is really without equal. It's just one example. In the last 24 hours, we've had so many additional physicians, nurses, and other healthcare workers not on shift come in to volunteer their time to make sure that all our patients are getting the best possible care. Joining me today are key members of our medical team who have been directly involved in the response efforts. They'll share updates on patient conditions, they'll explain the medical protocols we have followed, and answer questions as appropriate. But first I want to invite Dr. Richard McCullough, President of FSU, to make a few brief remarks. Dr. McCullough.
Thank you very much. From the bottom of my heart, I just wanted to express our gratitude to the healthcare professionals who took care of our students who were shot and injured, and we just appreciate it so much. We can't say enough good things about Tallahassee Memorial HealthCare. The hospital has done an amazing job with us throughout this tragedy, and we just appreciate so much the great job that everybody's done here. I just wanted to express that gratitude to all of you.
Dr. Brett Howard, I think will start us off.
Yeah, so my name is Brett Howard. I'm one of the trauma and general surgeons here at Tallahassee Memorial Hospital. We're going to go ahead and first introduce everybody. We'll start down at the end.
I'm Dr. Megan Morrow, one of the trauma and general surgeons here.
I'm Matthew Terzo, trauma and general surgery.
I'm Patton Pennington. I'm one of the general surgeons and trauma surgeons.
Melissa Amundsen, maxillofacial trauma.
Joey Gerard, general surgery.
Matthew Ramser, trauma and general surgery.
Jared Robertson, colorectal and general surgery.
Shelby Blank, general surgery and breast surgery.
Tracy Graham, emergency medicine.
So shortly before noon yesterday, we were notified of a event occurring on FSU campus. At that time, ER, surgery, and OR leadership, as well as our administration, responded to our emergency department and prepared to receive patients. Shortly thereafter, we began receiving patients. Those were gunshot wounds to extremities, chest, abdomen, all in rather stable condition. We activated certain resources that we have. This is unfortunately things that we trained for, although do not expect to occur, but we were prepared and activated certain resources. We in total received 6 patients. All 6 were in stable condition upon arrival. 3 of them did go to the operating room and have since left the operating room. All 6 of them today are in stable condition, one which is in fair condition given a serious injury. We do feel that all will make a full recovery. 2 of them are possibly going home today, which we're extremely proud of. Overall, like I said, unfortunately we do have to prepare for these sort of events, and I can't speak enough for the team that's here and the team that's not here. Our community, especially our medical community, is extremely close. Everything from our law enforcement, our EMTs, firefighters, FSU, is a really big part of this hospital, and so that relationship, as well as the relationship between our nurses, our techs, our doctors, really is why things here went very smoothly, and I am extremely proud of all of them. We will open up for some questions. Otherwise, that's it.
I had a question. Marcus,
Yes, sir.
I was with News Nation. In your line of business, is everything. Can you talk about the work of the EMS responders getting patients to you quickly, and then can you, in any sort of way, lay out what happens when you receive a sort of kind of, I don't know if you're going to call it a mass incident, but some sort of influx of patients from one area, how that works?
Yes, we have systems in place. We are communicating right away with law enforcement and EMS. The biggest part of this is you don't know how many patients you're going to receive. So we are prepared to activate as many resources as we need. That's why you see so many surgeons up here today, because they all came immediately to help. We have a trauma surgeon that mostly does breast surgery now. We have a trauma surgeon that does mostly colorectal, but they all respond. But yeah, the hardest part of it all is you don't know how many patients you're going to get.
Dr. Howard, can you talk with respect to patient confidentiality about the issues that you were able to treat? I mean, you have a variety of different surgeons up here from a variety of different disciplines. So what kind of injuries were you faced with?
Yeah, so Dr. Ramsey, if you want to give a little more detail on that.
We faced injuries that involved the torso and extremities, some of which require surgery, some of which can be managed without surgery. The response was very fast, and the patients were relatively stable, so we were able to successfully treat all of the injuries, which involved abdominal surgical procedures, and also facial surgery.
Without violating HIPAA, are you able to tell us ages of any of the victims, any sort of demographic information?
No, sorry, we can't give you any of the specific age details or details related to the patients.
Were any of you able to talk to any of the patients and describe their attitude coming in? Obviously, they're shock and trauma, so what was that like?
Yeah, so they were all, and I've said this on other interviews, very, very brave. There's the moment of shock, but all were able to talk to us, kind of how they're feeling, where they're feeling pain. But all of them were very clear-minded and able to converse with us.
Trying to get some clarity on the number. You said 6 total victims treated here. Does that include the suspect, or is he treated elsewhere? And were all of these gunshot victims?
Yeah, so 6 patients, that's all I can tell you.
Were they all gunshot victims?
Yes.
Doctor, can you clarify when you say fair and stable, is one worse than the other at this time?
So one we'll say is fair, mostly because of some of to the seriousness of their injury, but still should make a full recovery.
We keep hearing from students on campus that this has shattered their sense of safety and security. I'm wondering how you guys are doing after you've gone through what you went through, and also, I was here in 2014 for the mass shooting then. I'm wondering if any of you were here as well, and what that's like to go through several mass shootings.
Dr. Blank?
I was. It was, obviously a little more of a limited situation, but I think, unfortunately, traumatic violence is something that goes on, whether it's a few over the course of a weekend versus many compressed into a couple of hours. Obviously, this gets a lot more attention than than the injuries and the gunshots that happen on any given weekend in any given community. I think it's, it's something unfortunately you don't ever want to be inured to, but I think that, we were very lucky. Obviously, this was catastrophic, but given the numbers of students in that compressed area, the recipe for disaster is very scary.
So were you here during 2014?
2014, one of those students, all the students survived, but one did have drumstick, he's paraplegic. When you say all of the patients are expected to make full recovery, will any have lasting issues like that?
Again, I won't give any specifics at this time. I would say comparably, I expect all 6 to make full recoveries.
The 2 deceased, did they make it here at all? Was there any chance to, or was that an issue on just that location?
No, we received 6 patients. Yeah.
What is the condition of the shooter? The condition of the shooter right now?
We have no comment on any sort of related to the shooter. Yeah, we have 6 patients here.
So that's the clarification. You can't say that you
Correct.
and you can't say that they're students or not.
Correct.
So you have 6 victims here of a mass shooting. How does it work with them being treated? Are they on the, say for instance, they don't have insurance, the victims, are they on the hook? Do they have to pay, or does the state pay, or how does that work?
We treat every patient the same. All of that is handled separate from what we do. So yeah, again, we don't check insurance cards.
As far as the injuries are concerned and the caliber of weapon used, could you get into those details at all? Were there multiple types of calibers? I only say this because there was an eyewitness who told me they believe they heard 2 different types of guns used by the gunman.
Yeah, I don't have any specific information on that.
The patient was in fair condition. Was that the one who required facial surgery, or did you say?
I can't speak to that, sorry.
Is there a patient that required facial surgery?
Yes.
What would you say you learned from that event? I mean, because you guys, I think every time something happens, I'm sure you guys regroup, talk about it, and then, try to implement, God forbid it happens again. What was this like for you guys?
I'll say our system worked. We at least do 1 simulation a year. Again, we were prepared. I always like to say we learned something from every sort of interaction and any sort of event. So, but if anything, I'm just proud of everybody. I think what speaks to it is the relationship we have with our entire staff, with our hospital, and just the importance of continuing to practice.
1 simulation a year, is that table exercises, or do you have people wheel
We
in
do a
and-
full event. What
are the differences or similarities between reality and exercise?
Well, you can never replicate what just happened yesterday without living it. But we have all staff respond to it, everything from our blood bank to other personnel that are in other parts of the hospital, our administration. Everybody is involved in those simulations. But again, it doesn't complete. You don't get that anxiety, that the stress that you do with the real event.
Doctor, when you talk about injuries to the face and torso, how fortunate are some of these victims to be able to walk away and make a full recovery?
Yeah, so definitely very fortunate. Dr. Amundsen is our oromaxillofacial surgeon, so I'll let her speak a little bit more without going into details related to that.
I'm sorry, what kind of question do you have about?
How fortunate are some of these victims to walk away being able to make a full recovery, even though they receive wounds to the face and the torso?
Yeah, fortunate. I mean, we treat a lot of these types of injuries here, actually, ballistic injuries in particular. And so the course is generally several months, but we always return them to full function at the end.
We've got time for 2 more questions. We need to let them get back to work.
Members of the community, is there age they want to help? Is there blood that's needed, or just helping to kind of help themselves?
No, I'd say at this point, the best thing for the community is, just support each other. We know that there's a lot of advocates out there. We know we have our chaplain services. We have a lot of services to kind of cope with what's just happened. So we don't need any sort of blood donations, although I always say go out and donate blood. But yeah, no, nothing like that.
Did the location of the hospital being so close to the university kind of the time thing we all know is the most important, right? I mean, the people on the ground probably got to this stage. Do you guys think of it all that work probably to your advantage by having it?
Yeah, absolutely. We are a level 2 trauma center, the only within a certain distance, in the Big Bend. So we know what role we play. Thankfully, we are towards the center of Tallahassee, very close to the university. So it definitely helps in situations like this.
Dr. Howard, excuse me just a minute. Dr. Howard, can we let everybody go down the line and see if there's anything we've left out that needs to be provided and kind of instruction before we finish?
Any comments from
I don't
anyone?
have any additional comments.
No.
What is the cause of death of people that pass away? The war?
Oh, we have no information on any of that. Yeah.
I just have a last timeline question. When would you say things were under control, or what sort of phrase would you use for that? From getting the first patient until things were...
Within an hour. We had at least 2 patients in the operating room within an hour. We talk about time from patient arrival to getting CT scans. That was within an hour. So you talk about 6 patients, that's impressive.
Was there a victim treated for non-gunshot wounds?
Not that I'm aware of.
Doctor, you talked about how fortunate some of these victims were. Could centimeters have made a difference for any of them?
Yeah, of course. Yeah, gunshot wounds, it can be a matter of inches or centimeters.
Obviously, this comes as there have been conversations about the hospital's future. Elise Brown, Tallahassee Democrat, so local reporter was very involved in these conversations. I want to know if, at all, how does this moment kind of factor into that discussion?
It doesn't at all. We function, we've been in partnership with this community, FSU, for a long time. We operate as so no factors whatsoever.
This incident happened on Holy Week. Easter's on Sunday. Just wondering how this will impact your Easter plans and what you're carrying into the weekend.
Just spend time with our families. That's the same thing for us. We certainly are used to this, but we're all here to support each other, and we'll just take it a day at a time.
Any other comments from our physicians? Anything we left out or important to share? Do any of our physicians speak Spanish? He has a specific Spanish language question.
Somebody could speak Spanish?
I think this will be it, guys.
Thank you so much. Thank you for what you did. Thank you for being so gracious with your time.
Thank you.
Yes, we have an amazing team. Thank you all for being here.